Hello, my name is David Van Ryck, and this is the first part of a four-part lecture, which is an introduction to medical terminology. This presentation in all four parts is produced solely for education purposes for the University of Technology Sydney, and as such is covered by the standard copyright regulations. So, the naming of the major features of the human body follows an internationally agreed upon set of standards, and this makes sure that across the world health professionals are speaking the same language. And so, as a health professional, you need to be familiar with a wide variety of medical terms. What this lecture is about is giving you some pointers to help you with that process. So, in English speaking countries, the health professions mainly draw upon the Western medical tradition. Because of this, almost all medical terms in current use in countries like Australia have Latin or classical Greek roots. For example, we use in medical terminology duo, which is a Latin word, instead of saying two or twice. So we don't call it the duodenum, we call it the duodenum. Or we use hemo, or if you're looking at books from the United States, hemo instead of blood. So we don't say we're going to send the patient to the blood ward. We say that we're going to send them to the hematology ward. Some commonly medical terms are compound words. That is, are made up of several parts. So let's explain to you what a compound word is. Now, dog is a simple word, but underdog is a compound word. Serve is a simple word. Neoconservatism is clearly a compound word. Medical terms which are compound words are thus made up of one or more of the following parts joined together in a single word. There is a root, or in some texts and references you'll see this described as a stem. Sometimes there are combining vowels. There may be a prefix, and there may be a suffix. So what I'm going to talk about in this first part is some examples of roots. So the root is the part of the word that locates it to a particular part of the body or a bodily function. So here are some examples. When we talk about heart in medical terminology, we don't say heart, we say cardi, and you can see some examples here. This relates to inflammation of part of the heart. This is a means of measuring heart function, and this is a disease of the heart. And you can see in all cases, cardi is present. Sodium, we don't tend to use. We use the word natra, which is from the Latin natrium. So we can describe the blood level of sodium, or we can describe the passing out of sodium in the urine. Cell, we use the word cyto, so this is a white blood cell. This is when there is not enough platelets, which are a type of cell, and this is the science of cells. Muscle, we use my, as in this part of the muscle. It's part of a muscle tissue. If something is derived from muscle, and again, something to measure muscles with. Now, towards the end of the lecture in part 4, I'm going to give you some specific examples that you can commit to memory, but at this stage, all I want you to realize is what a root is. In each of these cases, you can identify the root, and that tells you what part of the body you're talking about. Oops. So I want to end this part of the lecture with a discussion of combining vowels. Now, in English, these are all the vowels, and for the purposes of simplicity, Y, as in fly, is also counted as a vowel. A combining vowel may be introduced in a term simply to make it easier to pronounce. So it's not anything that tells you about the specific part of the body or medical term. It's easy to get your mouth around the word. So we say cardiomyopathy. And in this case, these O's are combining vowels. We don't say cardiomyopathy, which would be equally correct. You've got, in fact, two roots here. It's just harder to pronounce. Fusiform is another example. If something is fusiform, it's shaped like a fiber. And again, correctly, we could say fusiform. But again, that just doesn't sound right. It's easier to say fusiform. Tachycardia, which is a elevated heart rate, so heart, instead of tachycardia. It kind of looks hard to pronounce the way it's written, so they put a Y in it. Sometimes you don't put a combining vowel in, you take a vowel out, because again, it sounds a lot easier to pronounce. So we say carditis, which is the inflammation of the heart, whereas correctly it's cardiitis. And again, you can see that it's to look at the word, it's quite challenging, but also it's a little bit difficult to pronounce. And that's enough for now, and that's the end of part 1. In part 2, we're going to look at prefixes.